Epigastric pain, very good. Mouth ulcers. Or epigastric pain, very good. Yeah, cold, C small letter. Amrita, write again. Write again, C-O-L-D, cold. Like this you have to write. Okay, in the middle of here bullet points, you will not get capital letters. Right. Heat source, maybe. Right. Next one. Question number 4. If you cannot guess now, it will be very difficult for you when the audio comes. Okay. Question number 4. Question number 4. Dashed, he had similar symptoms in the past and took dash to alleviate constipation. Okay, patient in a little pain. Okay. PT in a little pain. Alleviate constipation. Patient in a little pain. Okay. Right. Question number 4. Took dash. He had similar symptoms in the past. He had similar symptoms in the past and he took dash. Maybe medication, analgesia, analgesics, drugs, tablets, okay, capsules. Write down all these things. Write down all these things. Okay, or write down all these things. Write down, please. No capital letters. No capital letters. Tablets. Tablets. Maybe capsules. Or cream. Maybe balm. Maybe powder. Okay, laxative. Okay. Then injections. Maybe drugs. Maybe medication. Okay, don't be silent. Do something. Do something. Okay. Just simply sitting will not help you. Then suggested to take the medication called nausea, Gafoor, no capital letter. Okay, no capital letter. Put down. Okay. So small letter. So next one is question 5. Question number 5. Suggested to take the medication called Mebaverin in tablet form. Allergy check. Allergic to dash. Allergic to what? Allergic to what? Allergic to maybe pea plant. Allergic to drumstick. Maybe allergic to penicillin. Allergic to something else. Come on, come on, come on. Chaitra Gowda. Penicillin. Spelling mistake. Penicillin. Spelling mistake. Write down. Shellfish. Shellfish. Shellfish is one word or 2 words? Shellfish is one word. So you are not supposed to write 2 words. You will not get your mark. Shellfish is one word. How can you write 2 words? Okay. Write again. Who is that who has written shellfish? Yeah. Yeah, Meera Manoj. Write one word, please. Okay, sulfur drug. Yeah. Sulfur drug. Yeah, thank you, Meera. Then next one. sulfur drug, sulfur drug, yeah. Okay, good. Right. Next. Very good. Yeah, many people don't know these mistakes, so that's why I'm giving you all these things. Allergic to, yeah. Next one, dash mg. How many mg? Maybe roughly write some whatever mg. Yeah, olive oil. Okay, write down. How many mg? Maybe 100 mg, 50 mg, 200 mg, 250 mg, or 25 mg, whatever, 625 mg. You know better. Something you write, na? Who is this who has written mg? Nazia. Don't write mg. Amrita, don't write mg. Why are you writing mg? Huh? Amrita, no mg. mg is already there. See here. See, I am 53 years old. I am blind. So that's why I am putting this glasses. But I don't think you need glasses also. mg is there here. Nazia, no need to write mg. Remove mg and write again. Okay. Aruna, remove mg and write. Yeah, sorry. Who is that? Amrita, remove mg and write. Learn. Correct now itself. Otherwise, you'll forget. Simon sir made me to correct. So you remember afterwards. It will go into your blood. Intravenous injection I am giving now. Chaitra Gowda, again you are writing mg. Remove mg, my dear. No mg. mg is already here. Yeah. Next one. Question number 7. One tablet dash a day. One tablet dash a day. Twice a day, once a day, thrice a day, 10 times a day, 12 times a day, 24 times a day. Why do you want to write 2 times? You can write it twice. So 2 times also is correct. Phrase. That also. Nazia, why capital letter? Nazia Gafur. Okay, next time if you write capital letter, I'll make you write three times. Huh? Twice, thrice. That's better. Once, twice, thrice. Otherwise, 1 time, 2 times, 3 times. That's okay. Then whatever he tells, like that only. Okay. Nazia Gafur, again you are writing capital letter once. In the middle of the sentence, you will not write capital letter. Write again. It's small letter. Now, question number 8. This is my style, okay? I will shout like that. That doesn't mean that I'm angry. Okay, I'm correcting you. That's all. I'm shouting you so that you will be scared and you'll be doing. Exam fear I'm trying to bring. Eighth one, works in a factory, an office. Amrita, restaurant spelling mistake. A restaurant spelling mistake. A. Meera, wrong. A farm. A or an. Farm is singular, plural. A farm. A hospital, Nazia. A company, Chaitra. A is missing. A is missing. A is important. That is what he will be testing sometimes. Yeah. So, yeah, very good. All of you are writing. Very good. That's what it is. Amrita, restaurant spelling mistake. Somebody help her. Restaurant. Restaurant. Learn. Afterwards, write 5 times, 10 times, so that you will not forget this word. Restaurant. Restau. Yeah. This is the spelling. Yeah. There's a spelling. Write 10 times and keep it for yourself. No need to show me. Okay, but learn. Next time you should not write in the exam. You lose your mark. So next one is Okay. A restaurant. Very good. Thank you for helping others. Yeah. A restaurant, an office, a factory. Write down different things. A factory, a school, a hotel. Like the different things. And right now, make you see. It's not one answer you are giving. Think about 10 answers so that. I am not thinking about answer. I am thinking about how fast your brainstorming activity is going on. I want brainstorming activity. Who wants your answers? Nobody wants your answers. Brainstorming, speed. Just writing one answer, holding your hands and lazying yourself. That doesn't help you. Activate your brain cells. A pharmacy, a hospital, a clinic, a park, a hotel. A supermarket. Think about everything possible. Aruna, use small letter. A university. A university. Beauty parlor. Who is writing spelling mistake? Nazia, beauty. 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 Separate parlor, separate. Beauty parlor is not one word, please. Beauty parlor is not one word. Where is this girl Sahaya? She came and admit all. Yeah. Okay. Beauty parlor. Nazia, again spelling mistake. B capital letter, no need. So BEAUTY, beauty, PARLOUR, beauty parlor. A beauty parlor. Is a beauty parlor. Come on, be careful. Think about very nicely and then write. Yes, Sahaya, good evening. I thought you went again. Vinita. Okay. So new month, new batches. This is our new student, Dr. New students are there here today. New students are there, registered new students. Okay, from Nigeria, currently in the UK. Then Obidin, Dr. Obidin. Yeah, corporation. Yeah. So Aruna Madhuria. She's a nursing supervisor, nursing trainer or something. Okay, she's a new student. Welcome. Today is your first day, right? And there is Dr. Obidun. Where is he? Okay, so these are new students, right? Next one is new batch, new students. Okay, now I have increased. Normally I used to take 4 nurses and 3 doctors. Now I am taking 7 nurses and 3 doctors for this month, because last month second batch I did not take. So I am taking 7 nurses and 3 doctors. Whoever is interested, you can contact me afterwards. So then next one, question number, patient is dash. Okay. Question number 9, a daycare. Very good. A daycare, no, a daycare center. Question number 10. No, question number 9. Sorry. Yeah, question number 9. Question number 9. Aruna Madhuria, she inquired last month and she said, before my exam, I will join. So she has joined now. iPhone, Suma Maria. Yeah. Patient is lethargic by condition and prefers drinks to dinner. Patient is restless, patient is lethargic, patient is busy, patient is occupied. Yeah, Suma Maria, type your name, change it to patient is shy. Okay. Yeah, patient is okay. Adjective. Patient is dynamic, active, busy, engaged. Sahaya Vinoka, W small letter, write again. Write again with the W small letter. Write again. So, this is our new institute. All of you. You can see here, this is our new institute. Okay. So, we are going to start this month. So, if anybody is interested, you can. Yeah. One by one, things are going on. Yeah, patient is dizzy. Yeah, welcome, Sahaya. Yeah. Next one. Question number 11. Question number 10. Question number 10. Yeah. Worried that condition dash. Worried that condition may worsen. Worried that condition may deteriorate. Worried that condition may. You write down whatever you want to write. Why are you waiting? What for are you waiting? Huh? Yeah. Worried that condition worsening. No, condition may worsen. May deteriorate. Condition, worried that condition get worsen. No. May worsen. Can worsen. Might worsen. Might deteriorate. Okay. So worried means negative word. Okay. So condition disapproving, not suitable. Might worsen, may worsen, might deteriorate. Deteriorate. May condition may not improve. May deteriorate. Deteriorate. Okay. Might not improve. Okay. Worried that condition can fail. Worried that condition may. Okay. Next. Question 11. Question 11. Okay. GP recommends changes to dash. Changes to dash. Lifestyle, maybe. Changes to dietary regimen, maybe. Changes to medication, maybe. Yeah. It may be to anything. No? Yeah. Lifestyle is one word. Dietary regimen, right? Medicine, right? Good habits, right? Come on, come on, come on. A long way to go. Dietary regimen, blessing your seba. You are not supposed to write capital letter in the middle of the sentence. Why are you writing? So write again. Lifestyle, dietary habits. Okay. Dr. Swati. Dr. Swati is also a new student. Yeah. Next. Question 12. Question 12. Age. What can be the age? Age factor. Age factor. Or so Adira. Adira. So changes to smoking habit. Okay. Right. Yeah. So right. So now we are going to play the audio. Yeah. We are going to play the audio. Okay. Right.
Occupational English Test. Practice Test 1. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a pharmacist talking to a patient called Matthew Jenkins. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
You must be Matthew Jenkins.
Yeah, that's me. Just here to pick up medication I called about.
That's right, for nausea, constipation and diarrhea.
Yeah, I've got this prescription. Is this drug a good one?
It depends. There are several medications that could alleviate your symptoms. You mentioned that this is not your first time you've had problems with your bowels. Do you remember what you took before?
Before I just took laxatives to deal with the constipation. I think that's what this is now.
Yeah. Okay, and are you in any pain?
A little.
There's medication called mebiferine that may work. It'll certainly alleviate the constipation and ease any colicky pain too. It works on certain muscles in the walls of your intestine and causes them to relax. That's what eases the pain. I can give that to you today, and it's available as a tablet, modified release capsules, or oral liquid medicine. Which would you prefer?
Tablets, please.
Okay. Can I just check that you're not taking any other medications?
No, I'm not taking any others.
Have you ever had an allergic reaction to any medication?
I don't think so. No.
In that case, these should be fine. There aren't many side effects and it's pretty fast acting. They're 135 milligrams, and I recommend that you take one tablet 3 times a day. A lot of people take their doses around 20 minutes before their meals with a glass of water. They don't taste very nice, so don't try and chew on them.
Should I take them every day?
You'd usually take them when you need them, so don't worry if you forget a dose. And certainly don't take 2 doses together to make up for one you've forgotten. Just continue with the next dose when it's due.
Okay. I will certainly do my best to stick to them. I just hope that it works. It's getting really embarrassing. I work investments. Part of my role is taking clients to dinner, and we take them to some really nice places, fancy china, more cutlery than plates, you know the type.
Okay.
I noticed that you're from America. Can you recommend any places to take my clients?
For food?
Yeah, for just drinks or food. Or...
Well, I'd avoid getting anything that's in a cart outside.
Okay.
I think we've all been there and had some issues.
Yeah.
I don't know. Have they been to New York before?
Some of them have. It's just really awkward when I get through, going through a course. I have to dash off to the gents all the time. I don't know how many more excuses I can use to avoid taking clients out before I was getting started. So I'm thinking if I can just take them for drinks, maybe it's better than going for the whole dinner.
Well, there's plenty of rooftop bars on hotels, which are really lovely, and you can have drinks and have great skyline views. I recommend Soho and Chelsea, some great restaurants there.
Okay, I'll keep that in mind. Thanks for that.
No problem.
So other than taking these, is there anything else that I can do to manage this condition? I guess I'm just worried that it's getting worse.
What did your GP say?
My GP thinks that I should change my diet. She says there's no cure, but that the symptom can be managed. But part of the reason that she sent me to you.
I'm inclined to agree with that. If you don't mind me asking, how old are you?
I'm 40 this month.
Naturally, IBS may get worse as you get older, but I suspect that this would be if you were to make no changes to your lifestyle at all. Are changes to your lifestyle something you can do?
Yeah, I can do that. I can do that. So thanks for your time. I'll take these to the counter now, and thanks for the other information.
Have a great day.
Thank you.
Extract 2. Questions 13 to 24.
Yeah. So, right. Now what I'll do is I'll play again and you check your own answers. I'll play again and you check your own answers. Afterwards, I'll show you the answers. Listen again and check whether your answers are right or wrong. For those students who joined late, you can continue.
Occupational English test. Practice test 1.
Check and confirm.
Listening test.
If it is right, put a right mark. If it is wrong, put a wrong mark.
This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12.
You hear a pharmacist talking to a patient called Matthew Jenkins.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
You must be Matthew Jenkins.
Yeah, that's me. Just here to pick up medication I called about.
That's right, for nausea, constipation, and diarrhea.
Yeah, I've got this prescription. Is this drug a good one?
It depends. There are several medications that could alleviate your symptoms. You mentioned that this is not your first time you've had problems with your bowels. Do you remember what you took before?
Before I just took laxatives to deal with the constipation. I think that's what this is now.
Yeah. Okay, and are you in any pain?
A little.
There's medication called mebiferine that may work. It'll certainly alleviate the constipation and ease any colicky pain too. It works on certain muscles in the walls of your intestine and causes them to relax. That's what eases the pain. I can give that to you today, and it's available as a tablet, modified release capsules, or oral liquid medicine. Which would you prefer?
Tablets, please.
Okay. Can I just check that you're not taking any other medications?
No, I'm not taking any others.
Have you ever had an allergic reaction to any medication?
I don't think so. No.
In that case, these should be fine. There aren't many side effects, and it's pretty fast acting. They're 135 milligrams, and I recommend that you take one tablet 3 times a day. A lot of people take their doses around 20 minutes before their meals with a glass of water. They don't taste very nice, so don't try and chew on them.
Should I take them every day?
You'd usually take them when you need them, so don't worry if you forget a dose. And certainly don't take 2 doses together to make up for one you've forgotten. Just continue with the next dose when it's due.
Okay. I will certainly do my best to stick to them. I just hope that it works. It's getting really embarrassing. I work investments. Part of my role is taking clients to dinner, and we take them to some really nice places. Fancy china, more cutlery than plates, you know the type.
Okay.
I noticed that you're from America. Can you recommend any places to take my clients?
For food?
Yeah, for just drinks or food. Or...
Well, I'd avoid getting anything that's in a cart outside.
Okay.
I think we've all been there and had some issues.
Yeah.
I don't know. Have they been to New York before?
Some of them have. It's just really awkward when I get through, going through a course. I have to dash off to the gents all the time. I don't know how many more excuses I can use to avoid taking clients out before I was getting started. So I'm thinking if I can just take them for drinks, maybe it's better than going for the whole dinner.
Well, there's plenty of rooftop bars on hotels, which are really lovely, and you can have drinks and have great skyline views. I recommend Soho and Chelsea, some great restaurants there.
Okay, I'll keep that in mind. Thanks for that.
No problem.
So other than taking these, is there anything else that I can do to manage this condition? I guess I'm just worried that it's getting worse.
What did your GP say?
My GP thinks that I should change my diet. She says there's no cure, but that the symptom can be managed. But part of the reason that she sent me to you.
I'm inclined to agree with that. If you don't mind me asking, how old are you?
I'm 40 this month.
Naturally, IBS may get worse as you get older, but I suspect that this would be if you were to make no changes to your lifestyle at all. Are changes to your lifestyle something you can do?
Yeah, I can do that. I can do that. So thanks for your time. I'll take these to the counter now, and thanks for the other information.
Have a great day.
Thank you.
Extract 2. Questions 13 to 24. You hear a nurse talking.
Yeah. So let us check our answers now. Right. We are going to check our answers. So what we will do is pause the screen. So extract. Okay. Yeah. So Here are the answers. Here are the answers. Yes. Right. Let us number 1, 2, and 3. So let us check number 1. Answer: nausea, constipation, and diarrhea. Nausea, constipation, and diarrhea. Spelling. Nausea, constipation, and diarrhea. No capital letters. Capital letters must not be there. Somebody has typed this one and trying to help, but this is not right. There should be only small letters. If you have written capital letters, that means your answer is wrong. Cut your marks. Don't spare yourself. Okay, you don't know the rule that in the middle of the sentence, you're not supposed to put a capital letter. So you don't deserve to get the mark. That's all. That is what OET does. There are some rules behind the scene. Okay, next one, fourth question. Fourth question is took dash to alleviate constipation. Took laxatives, L small letter. L should be small letter, laxatives. Laxatives, L small letter. If it is right, put a right. If it is right, put a right. Yeah. So the next one, number 5. Number 5. Allergic to dash. Allergic to dash. Allergic to no medication. So he is not allergic to medication. That means he is not allergic. Allergic to something. No, he is not allergic to any medication. No medication. Okay, and small letter. He is not allergic at all. So allergic to no medication. Next. Who is this with this dot? iPhone. Who is this iPhone? I'm a little scared of iPhone. iPhone. Write your first name and second name, please. Because some people hack the phones. Ban, it seems. Who is this ban? 1, 2, 3, 4, 5. Okay, please write your first name and second name. 1 and 2. Please write that one. Okay. And this one, I don't know. Alpha, beta. Yeah, write your first name and second name. I'm giving you 3 minutes. Because I don't know, some people come and they hack and they throw some things and go off. Yeah, please. Yeah. Okay, fine. So what you can do is just type your first name, second name. No problem. You're all welcome here. All are welcome here. All are welcome, but only just type your names, please. Yeah. Right. So very good. So I'll be very happy to see some people instead of phones. Yeah. Next one. Next one is allergic to no medication. Dash mg. Question number 6. Question number 6. Dash mg. 135 mg. Question number 6. 135. That's all. 135. No need to write mg again. 135. Next. One tablet dash a day. How many times a day? 3 times or 3x. No need to write 3x. 3 times or thrice. 3 times or thrice. THRICE. Thrice also is okay, but 3 times or thrice. There's no problem. There's not a problem at all. Next one is dash, works in to dash. Investments, I know capital letter. I know capital letter, investments. Next one, patient is dash by condition and refers, brings to dinner. Patient is embarrassed. Embarrassed, E small letter, no capital letter, embarrassed. Patient is embarrassed. Okay. Patient is embarrassed. Next one. Question number 10. Worried that condition dash. Worried that condition dash is getting worse. Is getting worse. Is getting worse. Right. Is getting worse. Not will get worse. Is getting worse. Now itself it is getting worse. May get means doubtful, but is finished. Is getting worse. Next one. GP recommends changes to diet. Diet. See, these are correct. Is, diet, small letters, fine. So age 39. Age is 39. Okay. Age is 39. Now, update your scores, please. Update your scores, please. Update your scores, please. This month 40, that means 40 did not complete, so it is 39. So this month 40. This month 40, yeah, maybe. This month I am going to get 40. That means now I'm going to get 40. This month 40 means this month is not finished. Anytime it may happen. So it is 39. Yeah. I don't think they will tell so much, but fine. You have to be a little careful. Tricky question. Tricky question. Tricky question. Be ready for all these things. Nah? Yeah. Meera, you are doing good. 10 out of 12. Yeah. Meera is going for the exam this month, and Kennedy is going for exam month, and there is Karachi going for exam this month. All of you submit your scores, please. All of you submit your scores, please. Yeah, thank you very much. Please submit your scores. Right, that's very good. First place, Meera, 10 out of 12. That's good. Then second place goes to Blessing, 8. Meena Tombram, 8. Then Aruna Madhuriya, 8. The next one is third place, Chaitra Gowda, 7. Very good. So fine, no problem. Even if you are getting 1, 2, 3, whatever it is, we don't mind. Now, next point. We are going to do full test. I told you we are going to do full test. Okay, from today onwards till the exam, every day we'll do one full reading test, one full listening test. No problem. Okay. So, shall we go for the second extract? Shall we go for the second extract? Give a yes or give a no. Yeah, before that one advertisement. So our students went for exam, 3 students went for exam yesterday, and the last fortnight, another 3 students went. So we have last week we did not take admission, so we are taking. Normally I take 4 students for nurses and 3 students doctors. But this time I am taking 7 nurses and 3 doctors. Whoever is interested, 1 doctor is already taken and 2 nurses already taken. So still we have 5 places. Okay, 5 places. So the today's doctors are Obedion, Dr. Obedion. Then next one is another nurse. Okay, and then a new student nurse is Aruna. Yeah. So 1 nurse, 2 nurses. Sorry, 1 nurse from UK and Aruna. 2 nurses over. So 5 places are there for nurses, and 2 places are there for doctors. That's all. So if anybody is interested, you can get back to me. Yeah, Edukondalu, very good. Right. So, very good. Fine. So, next, audio. You don't know how to do audio. Edukondalu does not know how to do audio. Okay. So, yeah, 1 second. Yeah, get ready for the second one. So, at the bottom is the mic. At the bottom is the mic. Somebody give instructions, no? Somebody give instructions how to open the mic for audio. Okay. How to connect the audio. Somebody instruct. Somebody type instructions here for the new students. Please. Because okay, please. Waiting room, some students are there. Who are there? Annie. Okay. Waiting room. Everyone. Yeah. So somebody connect. Yeah. So just type yes or no. Yeah. Just type yes or no. We are moving to the next one. Yeah, Satya Sam is writing there. In the Zoom left side at bottom, one mic sign will be there. Kindly click on it. Yeah. Very good. Thank you, Satya. Right. So today only our new batch started. Those who are interested, you can contact me. Yeah. Yeah. Okay. Right. Next one. Let us see. Second part. This is the second one. We are doing complete test. Today is demonstration session for those who never attended my classes. So you can attend one listening session and you can attend one reading session. Afterwards, you must register for attending the sessions on a regular basis. There. Welcome to all the new students. My name is Peter Simon and I am a specialist for OET. Right. And I'm certified from Cambridge University. Yeah. So, full screen. Yeah, from here. Yeah, this is Nicole 1. Okay. Nicole 1. So print the screen. Be ready. So needs anything at night or dash. Needs. Okay. District nurses number. Okay, this is another point. Yeah. Now, So this is the second one. So go through this question 13 to 15. So we are starting the brainstorming session. Ban, I don't know, ban. Can you type it? Type your name. 1, 2. Can you type your name? Okay. First, second. Can you type your name, please? I need your names. Okay. So age dash. Nicole 1. Existing patient. Age. So you can guess your age. So question number 13. Brainstorm. Come on, write down your answer. Come on. Come on, write down your answer first. Whatever you think you can write there. There is no problem. Activate your brain cells. Yeah. So age 51. Off is not necessary. Existing patient age only number is enough. Off is not necessary because it's not continuation. Okay. So next one is question 14. Yeah, come on, write down. Condition. Medical history condition. What is that condition? Okay. What condition may be there? Medical history, what condition? Depression. Okay. Depression, hypertension, cancer, Meera, Manoj, see small letter, you will lose the mark in the exam. Okay, Meena, Tungram, hypertension. Come on, come on. Write down all of you. If you are careful with this one, you can get 12 out of 12 in the exam. Okay. So hypertension, diarrhea, vomiting, diabetic condition, diabetic condition, diabetic. Okay, let it be. Diabetes mellitus, fever, condition, name of the condition is not adjective, it is noun. Pneumonia, fever, right? Come on, think about all the possible answers. Brainstorming, not one answer. Try to think about all the possible answers. Brain should be activated. Who wants your answers? Okay, because there's suddenly one word come, you should catch it. That means you're mentally ready for that condition like that. Then, okay, COPD, yeah, capital letters. Asthma, Amida, small letter A small letter, rewrite with small a, rewrite with small a, rewrite with small a. Yeah, next. Think about all the possible answers, that's it. Question number 15. Question tuberculosis, very good. Chronic kidney disease, Santhya Sen, C small letter. Okay, question number 15. Takes medication via. Takes medication via. Ranjit, P small letter. Acute pancreatitis. Okay, P small letter. So, take medication via. Orally is not wrong. Via mouth. Okay, mouth will be correct. So, okay, write down whatever is possible, write down so that we can guess. Via means already adverb. So, intravenous. Veins, via veins, via pipes, via nose, via mouth. Okay. Dropper, D small letter, Amina. Amina, D small letter. Amina, inhaler, I small letter. Okay, infusion pump. Very good, very good. Very good, excellent. Okay. Intramuscularly, I small letter, Santhya Sen. Intrathecal. Okay. iPhone, I don't know who is this iPhone now. Right, very good. Intrathecal. Next one. Question number 15 over. Question number 15 over. Next one is question number 16. Question number 16. Oh. Question number 16. Okay. So get ready. Question 15 over. Question 16. 15 over 16. Had injection in right arm. Had injection in right arm. Injection. Last week, this week. Okay, before. Next. Okay. The last week. The previous week. The week before. Yesterday. Last fortnight. Last month. Last time. Last occasion. On the last, the previous, the earlier week, the last, the is a must. The day before yesterday, very good. The last week, the previous week, the earlier week, a few days back, very good. Come on, think. Sitting simply, think about all the possible answers. How come you will not get 24 out of 24? That is my challenge. Activate your brains. God has blessed you abundantly. The earlier week, the earlier, Chaitra, the earlier week, the previous week. Yeah. Very good, excellent, going on well. I like it. So next one is question 17. Question number 17. So, and we'll take injection in the left arm in the evening. There in the previous one in the morning also can come. No problem. Last time, on the last occasion, during the last occasion, anything will come. So question, and we'll take injection in left arm tomorrow or in the evening. Next, now. Tomorrow spelling Chaitra Gowda. Tomorrow spelling mistake TOMORROW, all O's only. Okay. At present, you can write at present also. Yeah, Meera Manoj read this time. At present also. Then next one, tomorrow morning, in the weekend. Very good. Come on. Activate. The next Monday, the coming Monday, the following Monday, the next Monday, after 2 days, Pranita, 2 space days. Okay. Yeah. Come on. Before discharge. Okay. Very good. Question number 18. Question number 18. So 18, house number also 18. Dash street, name of that street. After 2 days, not dates. After 2 days, 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 not dates. Okay. 2 days. Next one. Yeah. 18 dash street. Name of some street. Baker Street, Palmer Street, Winston Street, Hillary Street. Some name. Lane will not come. Meera, lane will not come because street is there. Street, lane, or avenue. So then already street is there. So lane will not come. Okay. Capital letter you have to write. Yeah. Very good. She has written capital letter. Brick lane. Lane means a street. Street means lane. So no need. Come on, think about some answer. Write down. Okay. Avenue will not come. Avenue street will not come. Avenue means lane, street, all same. Okay. Block. Any one will come. Okay. Bayers Street. Okay. No need apostrophe. Carnaby Street. Yeah. Very good. Come on. Think about that one. Any name will come. Right. Next one. Actively participate. Avenue, a capital letter should be there, but avenue will not come here. Along with the name, capital letter must. Street, capital letter. Separately street comes, it will not be capital, but name. Okay. Capital letter must be there. Brick street. Okay. Street, block, avenue, lane, all are synonymous. So, the next one. So today's date, month and date. Month should be written in words. Next one. That is question number Oh, question 19. Yeah, question 19, Gulenberg Street. Yeah, very good. Question number 19. Yeah. Slash is not needed. Slash is already there, Santhya. Slash is not needed. One space may. M capital letter. Name of the month should be capital letter. He will be checking capital letter. If you don't write capital letter, you lose your mark. Yeah, 22 June, 10 April. Very good. Come on, come on. One date you write so much time. 13 July. 5 May. 27 February. Yeah. 30 August. At least spellings I am checking. Na? 13 July. Learn the spellings of the month. One spelling will come automatically anywhere. 4th April. Yeah, 4 April. Very good. So next. Next is question number 20. Question 20. Name of the drug administered. Hydroxycobalamin. Frequency 2 days every dash weeks. 2 days every dash weeks. 2 days every dash weeks. Every 2 weeks. Every 3 weeks. Every 4 weeks. Okay. Chaitra, why are you writing capital letter? Control. Yeah, very good. Okay. 2 weeks, 3 weeks, 4 weeks, whatever. In the middle, no capital letter. Okay. Every alternate weeks. Okay. Alternate spelling. Alternate. Correct. Aruna, Santhya. Very good. Every alternate week. You remember, so alternate will not come here. Alternate means one. This week, alternate week will be only one. Every is there. So alternate will not come here. Okay, one also will not come here. 2 weeks, 3 weeks, 4 weeks, 5 weeks, anything more than one. Alternate will be only one. Okay, every alternate. This time next. Next is the alternate. So alternate is singular. Okay, so alternate will not come. Or you can say every is there. Every alternate week. Okay, or just alternate weeks. Without every alternate weeks, fine. Okay, that's fine. Next one. We are learning rules. Na? Question. This is how you will learn. That's why you don't miss the sessions under any circumstances. Question number 21. Yeah, route. Intravenous, intramuscular, oral, or whatever it is. Intrathecally. New word for me. Okay. Okay, through the spinal cord. Okay. Right, good. Thank you. So, nobody is a master. Everyone will be learning. So gradually we learn. See, we are learning from others. One is epidural, arterial, intramuscular, mouth, oral. Okay. So here, root, oral root. Okay, epidural, intramuscular, intrathecal, say all these things. So intrathecally, you are given a good word, but the thing is, root he is asking. 1 minute. Yeah, Meera Manoj. You have given very word. Intrathecally is the mode. Root is intrathecal. Okay. Intrathecally is the mode. And the root is intrathecal. Okay. You have given a good word, but that's your intravenous, intraosseous. I don't know all new words. Intraosseous. Okay. So maybe see, this is how we'll intraosseous infusion, the process injecting medication fluids or blood directly into the marrow of the bone. Okay, fine, very good, Ranjit, excellent. There are some very good students I can see now, new students. NG, nasogastric tube, nasal. So nasogastric tube is the mode. Okay. So, right. So, nasal or nasogastric. Okay. So, route, nasogastric route, or nasal route, oral route, intravenous route, intramuscular, all these things. Adjective will come. You're saying nasogastric tube. Tube is a noun. Okay. So, fine. We'll see. This is how we learn. A noun comes here. Which route? Oral route. Okay. Right. Sometimes we give, for example, what is that route? Another route. For children, if they have constipation, you give some through the anus. What is that route called? Is there? Do you have any name for that one also? Right. So, because I'm seeing number of fruits here. Okay. So, right. Maybe we'll learn. The next one. What is that medication called? Medication also called, I don't know. The anorectal, very good, Aruna, thank you very much. Anorectal, yeah, that's good. Very good, thank you. So I was not getting, maybe there may be name for that one also. There may be name for that one also. That's what I guessed. Okay. Yeah, that's fine. Then the next one. So what do you give? See, I forgot that name. What do you give for that small pieces of soapy liquid, something which you give through anus for small children when they don't get, they get constipation to release that, what do you call that medication termed as enema? Suppository, yeah. Enema, suppository, whatever, I don't know, I don't remember that one. I did not remember that one, okay. I know both the names, but I did not remember. Okay, fine, that's very good. So that's what I wanted to tell, but it was not hitting my head there. Because English I can say, but medical terms, they just sometimes I lag behind. Very good. Thank you very much. So if I leave that word now, then again I'll get stuck like this. So I'll be behind that until I learn. So suppository, enema. Okay, fine. Very good. Next one is question number. So this is how we learn. See, you are teaching the teacher itself. That's how it is. So question number 22. Question number 22. Yeah, once again, the early bird comes first, okay? There are only 5 more places for nurses. Maybe somebody has messaged me already, I think 1 or 2, okay? So if anybody is interested, you can contact me and get to me, right? This is my number, 9877867360. So if you want admission, you can contact me here. 9877867360. And today is the best session ever I am going to give. Goodiness? What is this goodiness? Giddiness, my dear. Gagging, okay. Yeah, I have to put it down. Yeah, Usual side effects, nausea and or. So if you have medical knowledge, you can just write like that. Who's this fellow? I don't know who has given this and capital letter, everywhere capital letters. So don't write capital letters anywhere, anywhere. Don't write capital letters anywhere. Somebody has prepared very nicely, but the thing is, something is missing there. Okay, so we'll try to rephrase these sets. Okay, fatigue, gagging, giddiness, spelling. What's the spelling of giddiness? Somebody type the spelling of giddiness. So we are increasing in number. You can invite your friends. You can invite your friends. Send the link to your friends. Giddiness. Somebody type the spelling giddiness. Okay. Dizziness. Giddiness. Okay. Yeah. All right. So for the new students, today and tomorrow, today listening and tomorrow reading free. You are welcome for the demo session. Okay. You are welcome for the demo session. Afterwards, you can register. Right. Next one is, so we started with just 3 people and we are now 20 people now. Very good. So giddiness, dizziness. Yeah, that's good. Next one is question 23. Question 23. Come on, brainstorm. Next of kin, Matthew is the son. Name of the daughter, maybe daughter-in-law, son's wife, daughter-in-law. Yeah, Margaret Thatcher. Okay, Margaret. Okay, fine. What time is the next session? Continuing, going on, non-stop nonsense it is today. I'm not going to allow you to sleep. Those who are really serious, prove that you are serious. Only those students I'm going to select for admission. Yeah. So, right. Julie, right? Whatever name you want to think, you can think, no problem. Just imagine, brainstorming. So Matthew is a Christian name. So maybe Christian name will come. Christina, Maria, Elizabeth. Okay, some name. Think about that one. Yeah, Farid is writing his name. Farid. Okay, your name you are writing now. Okay. No, I am not asking your name. I am asking the name of the daughter-in-law. Farid is not daughter-in-law. Allah is not daughter-in-law. Okay. Daughter-in-law's name. Matthew is the son's name. Daughter-in-law's name. Question number 23. Oh, Pranita Pamarthi, capital letter C. Okay. Capital C. Okay. Here, name of a person, capital is a must. Chaitra, Mary. M-A-R-Y, not M-A-R-R-Y. Marry means it's getting wedding. Okay. Yeah. So that's it. Then next one. Adam, grandson. Son, daughter-in-law. Only one son, one daughter-in-law. Next, grandson, granddaughter. That's all. Okay. So next one is, yeah, needs anything at night. Needs anything at night or dash. Needs anything at night or dash. Okay. So question number 24. Question 24. Question 24. Needs anything at night? District nurses number given in case patient needs something at night or in case of emergency. Okay. District nurses number given in case a patient when needs anything at night or emergency, maybe allergies. Yeah. Okay. Okay. Need anything at night or in case of allergies. Okay. If there is an allergy, or you can say, what else? At night is there. Late night is also night only. Madhurya. The next, side effects. Okay. In case of side effects. In case, already there. So no need in case. In case patient has side effects. Has is needed. Has a tiredness. Feels tiredness. Feels tired. Has side effects. Has allergies. Okay. So like that one, has rashes. Needs something or has. Patient needs, patient has. Imagine like that. Patient has chills. Patient has fever. Okay, patient has what is that called as um, um, you know, when the patient has something, you give keys to them to have. What is that? Um, what do you call? Somebody help me. What is it called? Ushers, Binu. What do you call that one when somebody gets shortness of breath? Yeah, shortness of breath also. And there is something called with a C. It will come. C is that seizure? Yeah, seizures. Yeah, seizures. Very good. Thank you. Thank you. Seizures. Epilepsy. Yeah, epilepsy seizures. C. I was telling not C as but seizures. The C. The next is not coming. Actually, sometimes it happens. Okay, seizures. Know the words, but many times I don't get. No, I came late. I don't have any idea. Farid, no problem. I'll give you idea. Don't worry, Farid. Dr. Farid. Yeah, good. Yeah. So needs anything at night or has um, headache, something like has a headache, something like. Very good. Now we are going to do numbness. Very good. Has numbness. See here, needs something at night or has something. Patient needs something or has something. So patient has, in case patient has something, you have to imagine like this. You have to imagine like this. Okay, very good. I loved it, really loved it. Farid, no capital F, small letter. So now tell me, how was the brainstorming session? Earlier you did not have brains, okay, while doing, but now you have brains. That means earlier you did not use. How was the brainstorming session? How was the brainstorming session? Yeah, give your give your points. How was the brainstorming session? Yeah. So this is the way. See, if I don't tell now, you will not think about has. You will get fever. Okay. Needs anything at night or fever? Needs fever. What do you mean by needs fever? Patient needs fever. Needs fever. Or so needs is gone or is separate. If needs something, needs anything at night. Anything is a noun. So anything, everything included. So or some other verb will come here. So you have to be very careful with the word. This is called collocation. Collocation. What goes with what? Collocation. What goes with what? Okay. So very good. That's really awesome. So Florence Mustafani. Okay. Nigeria. Yeah. Yes. Ready. Nicole 1. Nicole 1.
If you were to make no changes to your lifestyle at all. Are changes to your lifestyle something you can do?
Yeah, I can do that. I can do that. So thanks for your time. I'll take these to the counter now, and thanks for the other information.
Have a great day.
Thank you.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Nicole Von. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Vaughn. How are you today?
I'm okay, dear. Are you here to see me because it's my birthday?
Of course, that's right. You're 62 today. Happy birthday, Mrs. Vaughn.
Thank you, Pat. And please call me Nicole. My Matthew is coming to see me today too. He said he's brought me lots of presents and I'm very excited.
Oh, I bet you are. I won't keep you long then. I know you'll be wanting to get ready. I'll just make sure that you have your injection for pernicious anemia.
What's that?
It's just a fancy way of saying that right now your body's not producing red blood cells correctly. So this medicine will stimulate you to do that, okay?
Okay, dear.
It's the same injection that we did 2 days ago. Do you remember?
Yes, I do.
Okay. I'll just wash up in this sink and then I'll be with you, okay?
Sure, dear.
How are you feeling today?
I'm fine, dear. Just can't wait for everyone to arrive. Will you stay for the party, dear?
I'd love to. Only technically I'm still working, so I must dash after we finish. I can help you get ready, though.
Thank you.
Nicole, do you remember which arm you had the injection in last time?
My right arm.
Okay, we'll do it in the left arm this time. Before we go any further, I just need to check your identification if that's okay. Can you tell me what your full name is, please?
Nicole Eloise Vaughan.
And your address?
18 Winstanley Street, London, W1H 5LL.
And your date of birth?
3rd of June 1956.
And do you have any allergies?
No, I don't.
All right, that matches the chart. You're the correct patient. The drug that I need to give you today is called hydroxycobalamin, and it's to be done every 2 days for 2 weeks through the IM route. Do you know what the IM route means?
I'm not sure.
It means intramuscularly.
Okay.
Are you still okay with having injections?
Will it hurt?
You'll feel a little pinch when the needle goes into your arm. And I must admit to you, there are some side effects, okay, Nicole? And some of these can be nausea or headaches. Now, think carefully for me. Did you have any side effects when we did it last time?
I don't think so. Nausea, you say? Yes, I did feel a little nauseous the last time. Will I feel nauseous again?
Not necessarily, it depends.
Okay, dear, then let's do this, Pat.
Thank you. I'll be as gentle as I can. First, I'll need to clean the area. Are you sitting comfortably?
Yes,
Okay. Is it okay if I lift the arm of your blouse?
of course, dear.
Thank you. Oh, look at the clock. It's almost time for the guests to start arriving. Isn't that great?
Oh, yes.
I know Matthew is coming, but who else are you expecting?
The whole family, dear. He should be bringing Eloise, that's his wife, and the twins, Stephanie and Adam, so that will be a treat. You know, I've not seen the twins since they turned 3, and I hear they've grown so much. It's wonderful.
It really, really is. How old were they when you last saw them, sorry?
I think they were 2.5.
Ah, okay. Oh, and that's it. That's all done for you, Nicole.
Really, dear? Why, I didn't feel a thing.
I'm glad to hear that. And I'll pop a plaster on it in just a moment. I'll clean up now. If you need anything through the night or if you have any severe reactions, please call an ambulance, okay? It's dial 999. And if you do get nauseous again or have any rashes, will you call the district nurse's number for me?
Of course I will.
Do you still have it or would you like me to write it down?
I have it, dear.
Wonderful, wonderful. I'll get to cleaning up then.
Okay. So now what we'll do is, I'll give you a chance to check your work.
Of course, that's right. You're 62 today. Happy birthday, Mrs. Vaughn.
Thank you, Pat. And please call me Nicole. My Matthew is coming to see me today.
I guess I'm just worried that it's getting worse.
What did your GP say?
My GP thinks that I should. Thank you.
Extract 2. Questions 13 to
Your
24.
answers.
You hear a
Yes,
nurse
hypothetical
talking to a
complete
patient
answers.
called Nicole Vaughan. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Vaughan. How are you today?
I'm okay, dear. Are you here to see me because it's my birthday?
Of course, that's right. You're 62 today. Happy birthday, Mrs. Vaughan.
Thank you, Pat. And please call me Nicole. My Matthew is coming to see me today too. He said he's brought me lots of presents and I'm very excited.
Aw, I bet you are. I won't keep you long then. I know you'll be wanting to get ready. I'll just make sure that you have your injection for pernicious anemia.
What's that?
It's just a fancy way of saying that right now your body's not producing red blood cells correctly. So this medicine will stimulate you to do that, okay?
Okay, dear.
It's the same injection that we did 2 days ago. Do you remember?
Yes, I do.
Okay, I'll just wash up in this sink and then I'll be with you, okay?
Sure, dear.
How are you feeling today?
I'm fine, dear. Just can't wait for everyone to arrive. Will you stay for the party, dear?
I'd love to. Only technically I'm still working, so I must dash after we finish. I can help you get ready, though.
Thank you.
Nicole, do you remember which arm you had the injection in last time?
My right arm.
Okay, we'll do it in the left arm this time. Before we go any further, I just need to check your identification if that's okay. Can you tell me what your full name is, please?
Nicole Eloise Vaughan.
And your address?
18 Winstanley Street, London, W1H 5LL.
And your date of birth?
3rd of June 1956.
And do you have any allergies?
No, I don't.
All right, that matches the chart. You're the correct patient. The drug that I need to give you today is called hydroxycobalamin, and it's to be done every 2 days for 2 weeks through the IM route. Do you know what the IM route means?
I'm not sure.
It means intramuscularly.
Okay.
Are you still okay with having injections?
Will it hurt?
You'll feel a little pinch when the needle goes into your arm. And I must admit to you, there are some side effects, okay, Nicole? And some of these can be nausea or headaches. Now, think carefully for me. Did you have any side effects when we did it last time?
I don't think so. Nausea, you say? Yes, I did feel a little nauseous the last time. Will I feel nauseous again?
Not necessarily, it depends.
Okay, dear, then let's do this, Pat.
Thank you. I'll be as gentle as I can. First, I'll need to clean the area. Are you sitting comfortably?
Yes,
Okay. Is it okay if I lift the arm of your blouse?
of course, dear.
Thank you. Oh, look at the clock. It's almost time for the guests to start arriving. Isn't that great?
Oh, yes.
I know Matthew is coming, but who else are you expecting?
The whole family, dear. He should be bringing Eloise, that's his wife, and the twins, Stephanie and Adam, so that will be a treat. You know, I've not seen the twins since they turned 3, and I hear they've grown so much. It's wonderful.
It really, really is. How old were they when you last saw them, sorry?
I think they were 2.5.
Ah, okay. Oh, and that's it. That's all done for you, Nicole.
Really, dear? Why, I didn't feel a thing.
I'm glad to hear that. And I'll pop a plaster on it in just a moment. I'll clean up now. If you need anything through the night or if you have any severe reactions, please call an ambulance, okay? It's dial 999. And if you do get nauseous again or have any rashes, will you call the district nurse's number for me?
Of course I will.
Do you still have it, or would you like me to write it down?
I have it, dear.
Wonderful, wonderful. I'll get to cleaning up then.
What's happening? Oh, okay. Right. So now we are going to check our answers. We're going to check our answers now. So 13. 13. Okay. So get ready. Question 13. Yeah. So the answer for question number 13. Okay. So we have already written in your notebooks. So now we can check. Age. 13th answer. 62. 62. Then 14th answer. Pernicious anemia. Pernicious anemia. Pernicious anemia. Not just anemia, it's pernicious anemia. P small letter. Next. Had injected in the right arm, 16. Sorry. 15. Takes medication via injection. Takes medication via injection. Yeah. Takes medication via injection. Yeah. Then next. 16th. Previously or before or earlier. Previously or before or earlier. Okay. Today, this time. Today, this time. Anyone is right. Today, this time. Anyone is right. 18 is already there. No need to write again. Win Stanley. W-I-N. Win Stanley. S-T-A-N-L-E-Y. Win Stanley. Only this. No 18. Win Stanley. And question number 19. Today's date. 13 June. 13 June 2018 is already there. 13 June. 13 June. 13 June. Yeah. Can we write last name? Win Stanley is together one name. Right. Next one. 20th question, number 2. 20th question. Frequency 2 days every 2 weeks. 2 days, 2 days every 2 weeks. Next one, intramuscularly or IM. IM should be capital letters. Intramuscularly, IM. So root, intramuscularly or IM. Okay. Usual side effects. They have given here intramuscularly, but intramuscular is the root and intramuscularly is the mode. Okay, that's fine. Next one. Headaches. 22 headaches. Don't think that all these answers, if you write as it is, you will get right mark, because there are many other things so which were ignored while making this Jashan book. So H, headaches, no capital letters. This is enough for you to understand. In between, you should not put capital letters. Nausea or headaches. In between, no capital letters. And next one. Eloise. Eloise. Daughter-in-law's name is Eloise. Eloise. Okay. The next one. 24. Severe reaction. Has a severe reaction. Has severe reaction or has a severe reaction. Okay, second task will be little tough. Second task will be little tough. It's already midnight. Okay. So now, so you have checked your answers. 17 students are there. Okay, if at least 10 students are there, then we can continue for part B also. Because now your brain is very strong. Part 1 is over, so your part B will be ready. Directly, if you take part B, maybe you cannot concentrate. Now your concentration level has increased. So let us see how you'll be. What is this? My God. Second. Yeah. Louis, no, you cannot write Louis. You have to listen very carefully and you have to write. It's okay. But this question is not very authentic, so no need to worry. Because this name, if they give names like this, they will give the spelling also. So that's a must, either in IELTS or OET or anywhere. Right. So update your score. Update your scores, please. Only out of 12. Out of 12. Second 12. Out of 12. Update your scores. Then next one. So next point is update your scores. Part A, total out of 24. So first write out of 12, then write out of 24. Yeah, Meera Manoj 9, Ranit Suma 7, Chaitra 8, Meera 9, Pranita 6, Annie Mulenga 9, Amrita 10, very good Amrita, Aruna Madhurya 10, so 10 marks, Aruna Madhurya and Amrita both got 10 out of 12, so they stand in the first place, and Amina and Annie and Meera came in the second place, so with 9 marks, and nobody got 8. Anybody scores, please? Yeah. Now out of 24, submit your scores out of 24. Farid 0 out of 24. What you are doing, Farid? Okay. So because I am late. Okay. So let us see. Out of 24, how many got? Who got the highest? Let us see. Out of 24, those who have done 24 questions only, answer. So 8 plus 10, 18. Aruna got 18. Santhya got 13. Amrita got 16. Meera got 17. Yeah. So out of 24, Meera first place. Then Aruna second place. Aruna first place, 18. Meera second place, 17. Okay. Good. Keep it up, all of you. All of you keep it up. Now on my next question. Shall we go for the part B? Shall we go for the part B? Are you ready? Are you ready? This session is for mainly for the exam going students. Exam going students will not be ready and they'll be going to sleep. Okay. I want at least 10 members to decide. Okay, all of you. Just say yes or no. Ten members are there. I'm going to take the session. And from these students only, I will select the new students if anybody is interested for admission. Okay, with me, working with me will be needing dedication. So only those students who say yes will be allowed to join my classes. If you pay the fees also, we don't accept. Okay. So, yeah. Aruna or Meera or Suma, count how many yeses are there. At least 10 yeses are there or not. Total number of yeses. Farid is giving 2 times yeses. Why Farid? You want to cover double count? Yeah. How many yeses? 11 yeses. Okay. Fine. We are moving to part B. Afterwards, if again still people are ready, we will do part C also. Okay. First, what we will do is point by point we'll see. Okay. So view full screen mode. Yeah. Okay, get ready. All of you. Part B. What's happening? Okay. Okay. Is number 1. Yeah. Yes. These are the 7 questions. Get ready. Now, what I'll do is, yeah. Question number 25. Sorry. Question number 25. So look at this question. So now see this. I'm going to show you drastic steps how to save your time. Very carefully follow this one. Elimination. This is called commonality. Elimination. Okay. Commonality. Okay. Okay. Now this is the point. All negatives only. Doesn't. So here the concern is what? The concern is what? Yeah, before starting the second session, I'm giving you one more notice. Okay, right. There are 5 places for nurses and 2 places for doctors. If anybody is interested, you can contact me personally on my number. And this is my number. 9877867360. And the number is +91. You can save my number and you can contact me. Right. I can just do one favor for you. I'll give you my WhatsApp number, WhatsApp link directly, because saving and connecting number will be a little difficult. So, yeah. Yes. So we are closing the admissions today and tomorrow. So if anybody is interested, you can contact me. Copy link. Yeah. This is my WhatsApp number. You can contact me here personally. Okay. Then after the session or tomorrow, I'll contact you for admissions. So this is the June batch, and 2 nurses and 1 doctor admissions are finished. Right. Now coming to the point. So elimination technique. So now elimination done. This is deductive method. We call it as deductive method. And now the remainders. In the remainders, what are the most important things? Preposition is not that important. After, on, in. Prepositions are not important. So they also can be eliminated. Now, if you see very carefully here, so the patient is important. She's not bothered about the patient. She's not bothered about the patient. She doesn't look after the patient. She doesn't take care of the patient. Looking after means taking care of. Okay. Look after is a phrasal verb. Look after means take care of. monitor, supervise, observe, okay, help, assist, all these words, okay, look after the patient. So here the patient is important. The patient is important. Number two, she doesn't work on that ward. So ward, she doesn't work on that ward. Ward is important. Not belong to the ward. Okay, not belong to the ward. Next one, doesn't belong to the hospital itself. Okay, she is not from this ward, she is from another ward. She doesn't take care of the patient because she is not responsible. So this shows irresponsibility. This shows irresponsibility. First one is irresponsible. Irresponsible. First word is talking about irresponsibility. This is about responsibility, not responsible. So she is talking about responsibility here. Responsibility. So it is about irresponsibility because doesn't look after the patient. One word, you're transforming this into one word, that is irresponsibility. Next one. Next one is, she doesn't work on that ward. So she is from another ward. She belongs to some other ward, not related to ward. Okay, so this is a unit. Ward is a unit. So you have to notice that one. She doesn't work on that ward. That means she's from another ward. Okay, so the doctor was not able to give the background because she is not from that ward, because she does not belong to that ward itself. So why? How can she tell? The doctor tell her. Okay, so this is related to the place. This is related to the place. Okay, not right place. She does not belong to the right place. The place is ward. Okay, right. The next one is the hospital. She doesn't work in the hospital. She doesn't work in the hospital. She just came as a visitor, or she just came as a guest, or she just came as a observer or something. Okay, so she's not a participant. She's not a participant. She doesn't work in the hospital itself. She is an outsider. She is an outsider. This is an insider. Insider means inside the hospital but outside the ward. Okay, so try to understand that one. Right? This is total outside the hospital. Okay, she is in the hospital but outside the ward. Here it is totally outside the hospital. She doesn't work. Right? So try to understand. So try to observe that one very carefully. So this is the way how you have to analyze. Okay, right. Now let us see here. During the practice, ISBAR handover. Now what is this ISBAR handover? So can you recall what is ISBAR? I read somewhere, but I want to recall. So what is this ISBAR handover? What does I stand for? What does S stand for? What does B stand for? What does A stand for? What does R stand for? First write I. Come on, activate. Introduction. Yeah. Situation. Yes. Background. Then what? Acknowledgement or assessment. Okay. Assessment maybe. Next one R. Recommendations. Yeah. So handover. Why was the doctor unable to give a background? So during the practice ISBAR handover, why was the doctor able to give a background? So doctor was unable to give a background. Who does not belong to this hospital, this ward? Okay. So doctor was not looking after the patient. So handing over is there. So he's handing over, she is handing over, but she is not looking after the patient. So it is not regarding irresponsibility, but it is responsibility. She is not responsible for the patient. That means it is not in her jurisdiction. Okay, she is bothered about some other patients, but not this patient. So patient or ward or hospital. Okay, the doctor is handing over, is giving the ISBAR handover, is making the ISBAN handover. That time, she is not able to give the background in the third point. Background was not able to give. Why? Because the doctor is not looking after the patient. So this doctor is not the known patient, known doctor for this patient. Regular doctor. Just came today maybe. Not regularly looking after the patient. Just visitor doctor maybe. Guest doctor maybe. So not looking after the patient. So he's looking after other patients in this ward and other wards maybe, but not this particular patient. He does not belong to the patient. He does not belong to the ward. He does not belong, she does not, sorry, she. Okay. You hear a trainee doctor receiving feedback from a senior. During the practice ISBAR handover, why was the doctor unable to give a background? She means lady. So the person who is handing over is a lady. So you can see that she is treating other patients, but not this patient. It's not the point of responsibility here. So he is not responsible for the patient. That's it. That means other patients, okay, but this patient and some other, there may be 100 patients in that ward. So some shared by him, some shared by somebody else, maybe. So that's it. He is not looking after this particular patient because it is not his responsibility to take care of this patient because duty. Okay, next one. This doctor does not work on this ward itself. Actually, she works in some other ward, maybe. Temporarily, she is posted, maybe. So you have to analyze like this. Now, she came from another hospital as a guest to this hospital and doing this treatment or something like that, maybe. So like this one. I hope you understand what I am telling. Is that clear? Is that clear? Say yes fast because we're running now. Yeah, I need just 5 yeses. So we'll go. If anybody wants to say no, okay, I'm counting 3. 3, 2, 1, and then nobody said no. So no is more important than yes. Okay, now we are playing the audio.
According to what you hear.
Wonderful. I'll get to cleaning up then.
Different extract. That is the end of part A. Now look at part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 1 to 6, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 1. You hear a trainee doctor receiving feedback from a senior. Now read the question.
So how do you think that went?
I think it went okay, but I think I made a mistake with the number of compressions.
Unfortunately, that's right. You gave 20 compressions when ideally it would be 30. You also need to make sure that the seal over the mouth is tight before you do the head tilt and chin lift.
Thank you.
It's okay. I mean, you have your ARCP coming up, and I just want to make sure that you pass it the first time. Is there anything else within advanced life support that you'd like to go over?
If at all possible, I'd really appreciate it if we could look over the handover part again.
Sure. So in this scenario, when the critical care team arrives, you would give them a professional handover using the ISBAR framework. For example, I found this collapsed patient on the ward, so I decided to investigate as I was passing by. So the situation is, I was walking by a collapsed patient. The background is, I don't have any background on this patient and is not under my care. I work in this hospital but not on this ward, so I can't give you any past medical history. My assessment of this patient is, I did a trapezium squeeze, there was no response. I checked his mouth for any food boluses or dentures. There were none, he was still unresponsive. I did a head chill chin lift for 10 seconds for the rise and fall of the chest.
Now look at question 2.
Yeah. Now, don't try to write the answer until I tell you. Okay. Question number 25. Yes, 7, 6, 5, 4, 3, 2, 1. Submit. Santhya, there is no 2, there is ABC. How can you write 2, Santhya? Rewrite with ABC. Yeah. Now let us check the answer. $25 is B. I don't take care of this patient or something. I do work in this hospital, but not in this ward. I am working in this hospital, but okay, not this ward. I work in this hospital, but not in this ward. That means another ward. Not in this ward. Not in this ward. Not in this ward. I work in this hospital. I work in this hospital, so doesn't go on. I work, she works in this hospital, she doesn't is wrong. So C is ruled out. I work in this hospital, but not in this ward. Not in this ward. So this is how you go. So B is the right answer. Right. That's it. So update your score. If your score is 1, write 1/6. Part B scores. Update. Right. 1 by 6. Okay. Come on, come on, come on. I don't have all the time in the world. Come on. People who are not ready to even write one letter or one word. Okay, no problem. Go and relax and sleep. Na? Right? Sir is explaining so much. Huh? You don't know, I forgot to have my dinner also. Huh? But still I am teaching you and you don't want to write even one letter. Huh? Very sad. Right. Now we are moving to the second one. Yeah. This is the second question. You hear a consultation between a GP and a patient. When did the patient's dizziness start? Start means commence. Okay. So when did the patient's dizziness start? Don't see the question. Question is not important actually. Question is never important. Question is never important. Eliminate commonality. Eliminate commonality. So 2 and 2. Okay. 2 and 2 eliminated. Ago and ago eliminated. Okay. All of it. Right. Now if you excuse these things, this is eliminated. Okay. Because that's not that important. So now the point is 2 weeks, maybe fortnight also. Okay, he may say fortnight and he is testing you whether you know fortnight means 2 weeks or not. So the words, important words are these now. The important words are these now. Suddenly, suddenly started. So dizziness started suddenly, or dizziness started weeks before, or dizziness started months before. So weeks will be converted into months. 4 weeks is equal to 2 months. So just weeks, not month, not even 1 month. Suddenly it happened, or 2 weeks ago it happened, or 2 months ago it happened. So focus on suddenly, weeks or months or suddenly, that's all. Weeks or months or suddenly, that's all. That is the clue for you. Okay. Focus on this. This is how you can eliminate words. And you can focus on one particular word. So suddenly, or weeks or months. So weeks, months, not both. Either weeks or months or none. So this is none. This is none, not weeks, not months. Okay. This is weeks. This is months. This is none. None, weeks, months. What row? How many times you are going and coming? Check your internet facility fast. Okay. So next one. So any doubts? Yes or no? If your doubts are there, yes. No doubts, then no. Okay. All right. Yeah. Come on, let us start the audio.
You hear a consultation between a GP and a patient. Now read the question.
I've come in because I've got this booming headache and it's driving me up the wall. I'm just hoping there's something you can do.
All right, did this start today or is this an ongoing thing?
No, it's happened at least the last couple of weeks now. You know, obviously I had that heart attack 2 months ago. It might be related to that, I'm not too sure. But yeah, it's been the last couple of weeks.
All right, and would you say it's come on gradually or all of a sudden? Did you kind of wake up with it one day or was it kind of, it was getting worse? How would you describe sort of the onset of the headaches?
Do you know what? It felt all of a sudden, but it has been getting worse. And this is not my first time in the GP. Do you know what? I might set up camp here. I've been in at least a couple of times in the last couple of weeks now.
All right then. Yeah, I know. So last time you were here,
Yeah.
you mentioned that you were getting dizziness. Is that still a problem for you?
Yeah, I'm still getting dizziness. I'm still dizzy from time to time. Do you know what? It's even affecting my sleep. I'm tossing and turning, and it's booming. I just can't get rid of it.
Okay. And when did this the dizziness start?
Around the same time as the headache.
Now look at question 3. You hear a podiatrist discussing multidisciplinary care. Now read the question.
So it started same time as headache. Already answer was told. You should make notes there. Headache, when it is start. He may tell like that one. You already lost the answer. If you are only waiting for a dizziness, you have already lost the answer. Okay. So you should make a notice. So headache, when did it start? So then what other thing? When did it start? So based on that one. So it started almost the same like headache. Okay. So you have to focus. Now check your answer.
First time. Is there anything else within advanced life support that you'd like to go over?
If at all possible, I'd really appreciate it if we could look over the handover part again.
Investigate as I was.
Now read the question.
I've come in because I've got this booming headache and it's driving me up the wall. I'm just hoping there's something you can do.
All right. Did this start today, or is this an ongoing thing?
No, it's happened at least the last couple of weeks now. You know, obviously I had that heart attack 2 months ago. It might be related to that. I'm not too sure, but yeah, it's been the last couple of weeks.
All right. And would you say it's come on gradually, or all of a sudden? Did you kind of wake up with it one day, or was it kind of it was getting worse? How would you describe sort of the onset of the headaches?
Oh, do you know what? It felt all of a sudden, but it has been getting worse. And this is not my first time in the GP. Do you know what? I might set up camp here. I've been in at least a couple of times in the last couple of weeks now.
All right then. Yeah, I know. So last time you were here,
Yeah.
you mentioned that you were getting dizziness. Is that still a problem for you?
Yeah, I'm still getting dizziness. I'm still dizzy from time to time. Do you know what? It's even affecting my sleep. I'm tossing and turning, and it's booming. I just can't get rid of it.
Okay. And when did this the dizziness start?
Around the same time as the headache.
So
Now look at question 3. You hear a podiatrist discussing multidisciplinary care.
right. Yeah. So now here, question 26. Question 26. Question 26. Yeah. So 7, 6, 5, 4, 3, 2, 1. Submit. Submit fast. How much time I have counted? 7 seconds. Till you people need time? Okay. Now let us check the answer. Second answer is B. Couple. What do you mean by the word couple? You should know all these things. You people don't bother about these things, synonyms and all. What do you mean by couple? Couple. Two. Mainly two. Or few things that are similar or the same. Or two are a few people who are in same way. Couple means mostly two. Okay. Mostly two. Okay. So remember that couple means mostly two. Two people who are married. Two. Couple means two. Yeah. Couple means to join or combine. Right. Couple means a sum. So these are the synonyms. Okay. Couple means two or three or some, whatever. So two is not a problem here. Couple is not a problem. Is it weeks or months? It is weeks. It started a couple of weeks ago. Okay. It started a couple of weeks ago. So, right. Worsening suddenly. Okay. But started earlier, 2 weeks. Suddenly started worsening. Okay. But started 2 weeks ago. So that's you have to remember. It happened the same time as headache. So start from the beginning, it is connected to the ending. So you have to be very careful. Okay. If you can catch this answer, that means definitely you can. Annie Mulenga, you have to write A, B, C, not. Okay. Fine. I already wrote B. Okay. Now update score 2 by 6 or 1 by 6 or 0 by 6. Update 1 by 6, 2 by 6, 3 by 6, 4 by 6. So 2 by 6. Yeah. Come on, first, all of you. I'm going to tell you, I'm teaching you all the secrets here. Dead secrets I'm showing you. Okay. Many people will be ready to listen only. They don't want to do all these things. Okay. Right. All of you write down your scores. Please, please, please. Okay. Next. Third question is here. Third question is here. You hear a podiatrist discussing multidisciplinary care. Multidisciplinary care. Which of the following professionals does she discuss working with? Okay. So you hear a podiatrist discussing multidisciplinary care. So a podiatrist is discussing multidisciplinary care. So which of the following professionals does she discuss working with? So with whom is she working? Is she working with other podiatrists? Or is she working with orthopedic nurses? Or is she working with osteopathic practitioners? So she's working along with them now. She is working along with them now. So what about the others? She is a podiatrist. But what about the others? It is a multidisciplinary care. But is she discussing with other podiatrists? Or is she discussing with orthopedic nurses? Or is she discussing with osteopathic practitioners? Osteopath. Okay, nurse. So she is a podiatrist and she is discussing with a nurse. She is a podiatrist and she is discussing with other podiatrists. And she is discussing with osteopaths. So, nurse, podiatrist, or osteopath. So, is she discussing with the same professionals or others? Or if they are others, it is nurses or osteopaths. So, try to understand. So, now the point of question is podiatrist with nurse or with other podiatrists or osteopaths. So that you have to see there, right? So focus on that one. Is she discussing working with? She discusses working with whom? Orthopedic nurses, orthopedic, forget it. So podiatrists and osteopaths, professionals, with somebody, with nurses, with other podiatrists, with osteopaths. So remember that very carefully. So which of the following professionals does she discuss working with? So she is discussing about working with whom? That you have to see. Now she is maybe working or not working, but she is discussing with somebody, but with whom is she working actually? Okay. So the present scenario is different and the working scenario is different. Focus on that one. So she may be working with podiatrists and she is discussing with the podiatrist about working with nurses. So be careful. Now she is working with podiatrists. All the podiatrists are together, maybe. All the podiatrists are together, maybe. So she is discussing with the other podiatrists about working with whom? Working with nurses, or working with osteopaths, or working with other podiatrists, maybe. Who knows? So present she is discussing with somebody, and presently she is working with somebody, and earlier she worked with somebody and she is discussing with somebody. So try to be clear here. So with whom she is discussing, and with whom, about whom she is discussing. Okay, right. So she is discussing with somebody, so face to face, and this working with somebody else. Okay, so she is discussing, this is podiatrist, she is discussing with somebody else. Okay, so which of the following professional does she discuss working with? So who is this we need, not this. Okay, so I am discussing with you about exams. Okay, right. Now let us see. So focus on nurses, focus on podiatrists, focus on osteopaths. So this is, to speak frankly, this is podiatrist, means related to feet. This is related to feet. And this is related to bones. Try to understand. Okay. So if you understand that one, if you find out those things, that will be very easy for you. This is what is seeing through the maze. So osteo. Osteo is related to osteology. The scientific study of bones. Osteo means bones. So is she talking about bones? Is she talking about feet? Or is she talking about nurses? That's all. Nurses, feet, bones. Try to understand that one. So focus on what she is talking. If it is feet, then podiatrist. If it is bones, then osteopaths. Then if nothing else, these two things are there, then it is nurses. Either feet or bones or none. This is none. This is none. This is feet, means podiatrist. Bones means osteopaths. If nothing, not feet, not bones, then it is nurses. That's it. This is how you have to identify. So, concept check questions. Concept clear. Say yes or no. First. Y or N. Only one letter is enough. One letter is enough. Y or N. At least 3-4 members. If they send, then yeah, very good. That's enough. Now let us see. Let us listen to this one. So this is not feet, not bones. This is only feet. So only feet, only bones, not feet, not bones. That's all. So right.
Did you kind of wake up with it one day, or was it kind of, it was getting worse? How would you describe sort of the onset of the headaches?
Oh, do you know what? It felt all of a sudden, but it has been getting worse. And this is not my first time in the GP. Do you know what? I might set up camp here. I've been in at least a couple of times in the last couple of weeks now.
All right then. Yeah, I know. So last time you were here,
Yeah.
you mentioned that you were getting dizziness. Is that still a problem for you?
Yeah, I'm still getting dizziness. I'm still dizzy from time to time. Do you know what? It's even affecting my sleep. I'm tossing and turning, and it's booming. I just can't get rid of it.
Okay, and when did this the dizziness start?
Around the same time as the headache.
Now look at question 3. You hear a podiatrist discussing multidisciplinary care. Now read the question.
As a podiatrist, working alongside other healthcare professionals is great and absolutely necessary. We work very closely with other healthcare professionals such as physiotherapists, osteopaths, orthopedic surgeons and GPs, to name just a few. We all kind of help each other, and sometimes the problems overlap slightly. For example, somebody could be presenting with a problem that needs both podiatry and physiotherapy, or sometimes I'll need to refer my patients back to their GP in order to get things like antibiotics, or just for a referral on to somebody else, possibly within the NHS. So yeah, we work very closely with a lot of other healthcare professionals.
Yes.
Now look at question 4. You hear 2 nurses discussing malaria.
Check your answer.
I've come in because I've got this booming headache and it's driving me up the wall. I'm just hoping there's something you can do.
All right, did this start today or is this an ongoing thing?
No, it's happened at least the last couple of weeks now. Obviously I had that heart attack 2 months ago. It might be related to that, I'm not too sure, but yeah, it's been the last couple of weeks.
All right, and would you say it's come on gradually or all of a sudden? Did you kind of wake up with it one day, or was it kind of, it was getting worse? How would you describe sort of the onset of the headaches?
Do you know what? It felt all of a sudden, but it has been getting worse, and this is not my first time in the GP. Do you know what? I might set up camp here. I've been in at least a couple of times in the last couple of weeks now.
All right then. Yeah, I know. So last time you were here, you mentioned that you were getting dizziness. Is that still a problem for you?
Yeah, I'm still getting dizziness. I'm still dizzy from time to time. Do you know what? It's even affecting my sleep. I'm tossing and turning, and it's booming. I just can't get rid of it.
Okay, and when did this the dizziness start?
Around the same time as the headache.
Now look at question 3. You hear a podiatrist discussing multidisciplinary care. Now read the question.
As a podiatrist, working alongside other healthcare professionals is great and absolutely necessary. We work very closely with other healthcare professionals such as physiotherapists, osteopaths, orthopedic surgeons and GPs, to name just a few. We all kind of help each other, and sometimes the problems overlap slightly. For example, somebody could be presenting with a problem that needs both podiatry and physiotherapy, or sometimes I'll need to refer my patients back to their GP in order to get things like antibiotics, or just for a referral on to somebody else, possibly within the NHS. So yeah, we work very closely with a lot of other healthcare professionals.
Yeah. So
Now look at question 4. You hear 2 nurses discussing malaria.
right. Question 27. Yes, 7, 6, 5, 4, 3, 2, 1, submit. Wow, very active. Very active. Come on, come on, come on. I love this activity. Yeah. Danyas Kharia. Yeah. Next. Now let us see the answer. answer is C. The answer is C. So, update. Farid, don't send personal message, please. Update, because every time you send personal message, then I have to change it. Update, yeah, please. 3 by 6 or 2 by 6 or 1 by 6. Yes. So Dr. Farid, okay. So you have to get more score, okay. Attend regularly and get more score, better score. Right. Yeah. So what you are supposed to do is, fine. So that's good. Now next we'll go on to the next question. Oh, sorry. Yeah. So next question is 28. You hear two nurses discussing malaria. You hear two nurses discussing malaria. Okay. You hear two nurses discussing malaria. Right. Yeah. So, Yedukondalu, tomorrow I'll give you some responsibility. There are some doctors and nurses. See how I am going to ask some questions to them. So you have to ask these questions and you have to make them speak and you have to give practice. Okay, so listen to what I'm telling. These are our regular students, most of them. Yeah, you can remember this: Amrita, then Aruna, Blessing, Danya, Dr. Farid, Meena, Meera, then yeah, Pranita, Suma Maria. So these are regular students, others are guests. So I'll give you some students, you can discuss with them. Okay, I'll give you some questions, you can ask them, you can ask them so that you can give them speaking ground practice. Okay, just ask the questions and they'll speak on the spot like that. To give them, because I'm not able to give a lot of time to the students, so that's why I am appointing you as my assistant. Yedukondalu. He's a teacher. Okay, he's a teacher. So just to oblige, he's just an interlocutor. So Yedukondalu, can you unmute? Can you unmute that mic button? You can click. Yeah. Yeah. Can you speak?
Yes, sir.
Yeah. Mr. Yedukondalu is a government employee. Okay. So he's a teacher. He has an experience of almost 25 or more years. And I am going to give him some responsibility for making you eloquent. Blah, 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 speaking, blah, 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 speaking. That means fluency, like with me accuracy, with some other people you do fluency. That means practice there. Then when you come, you'll get confidence. So I'll give him a set of questions. So every day I'll give him some 10 to 12 questions, 3 cards questions. 3 card questions. He'll just ask you questions. You have to just answer. For example, yeah, right. Who are the students who are going for exam here? Anybody going for exam? Raise your hand on the 13th, please. Anybody exam? I'm just giving you a demonstration for our Yedukondalu. Anybody is going for the exam or anybody is ready to volunteer? Please raise your hand. I'll just ask some questions, normal questions, whatever you are doing. Yeah, anybody? Raise your hand. Otherwise, I'll call myself. Just practice now. I'm giving some training for him. That's why. Okay. So let us see. Dr. Farid, unmute. What to do? He's a man, so I open him because I cannot force everyone. Girls, maybe they'll be hurt if I don't. Yeah, Dr. Farid, ready? Dr. Farid, what is this diabetes mellitus? You said something, I have this problem, diabetes mellitus. What's this exactly? Why I am getting this problem? What are the reasons? And how can I protect myself? Tell me. Yes, Dr. Farid.
Hello? Hello, Dr.
Yeah, come on, answer. What is this diabetes, doctor? Why did I get this diabetes? Can you explain?
Sorry? Hello?
Yeah, carry on, speak. Okay, Dr. Farid has some problem with his mic. Anybody can volunteer? Just simple thing, what you are speaking. Anybody? Anyone? Yeah. Blessing Yerseba. Hello, Blessing. Unmute.
Hello.
Yeah, hello, dear. Blessing, what is this diabetes? Why am I facing this problem? Can you tell me the reason? Hello?
Hello.
Yeah. Blessing
Okay.
Yerseba.
Diabetes mellitus is a result is a disease as a result of too much sugar in the blood, high group high blood glucose.
Okay. So there are many people fine, but why I am getting this problem? What is the reason? And how can I come out of this situation? Is this a permanent disease or can I come out of this problem? Or should I face it lifelong?
It is not a permanent disease. It can be managed. You can control it. So as far as you control the disease, I'm sure you are good to go. Everything will be fine. Then there are some factors that makes you get diabetes. So if you just follow the treatment regimen, you'll be fine.
Yeah, so that's fine. Thank you very much. Blessing. Yeah, Edu Kondalu,
Sir,
do you understand now? I'll just write and give, I'll type and give. You have to ask the questions as they are, that's all. Is that clear?
yes, sir. Yes, sir.
Okay, fine. You can mute back. Okay, right. So these are our very precious students. We take limited students, so you can help them by giving them proper practice before coming to me. Yeah. Now you hear two nurses discussing malaria. How long is malaria? How long is malaria? Why two is? Why for? How long is there for? For how long is malaria asymptomatic? For how long? The right pattern of the question is for how long? For how long? Or no need for also. How long is malaria? How long is already period. So no need for also. How long is malaria asymptomatic? Asymptomatic without any symptoms. So for how long is malaria asymptomatic? Means without any symptom. A means without. A means without. Asymptomatic. How long does malaria not exhibit symptoms? 7 to 8 days. 8 to 17 days. 7 to 18 days. So 7 to 8, 8 to 17, or 7 to 18. So minimum 7, maximum 8. Minimum 8, maximum 17. Okay. So focus on this one. So 7 to 8, 8 to 17, 7 to 18. So remember that very clearly. All right. So how long the duration without showing any symptoms? When are the symptoms exhibited? Is it after 8 days or after 17 days or after 18 days or maybe 7 to 8 days? 7 to 8 days. 7 to 8 days. So short span. 8 to 7, moderate. 7 to 18. Okay. So try to understand this one. Right. So you can say 7 to 8, only 2 days. Okay. So 7th day or 8th day or any time afterwards, not before 7th day, not before 7th, not before 7th. Okay. 8 to 17. So not before 8. 7 to 18, before 7. And so within these periods, they will be, okay, 7 to 8 days, they show symptoms. 7th day or 8th day, they show symptoms. Or 8 to 17 days, anywhere they can show symptoms. And 7 to 18, anywhere they can show symptoms. So focus on that one. So when you say here 8 to 17 days, there is no problem. But when you say 7 to 8 or 17, 7 to 18, 7 to 8 is very short, 2 days only. 7 to 18, you can say 11 days, right? Fine. So this is minimum, this is maximum, this is moderate. So this is very soon. 7 to 8 is very soon. In this, either on the 7th day or on the 8th day, symptoms, not before. 7th or 8th day, symptoms are exhibited. That's it. Very short. These 2 days only, symptoms are exhibited. Right. Now I'm going to play the audio.
To refer my patients back to their GP in order to get things like antibiotics, or just for a referral on to somebody else, possibly within the NHS. So yeah, we work very closely with a lot of other healthcare professionals.
Now look at question 4. You hear 2 nurses discussing malaria. Now read the question.
The practice manager's just approved my leave. It just got approved, so guess who's going on holiday?
Judging by your smile, I'd say you. Anywhere nice?
Haiti. Although I've no idea what to do about the malaria endemic. Do you know much about malaria?
Actually, I saw an article about it the other day. Where did I put it? Oh, here it is. So it says, malaria is a major disease affecting hundreds of millions of people throughout the world. It's been around for thousands and thousands of years, and it's mainly found in tropical countries. The disease is transmitted by mosquitoes, and it's usually the female mosquito that bites humans. It's part of the mating process for the parasites, and their bite injects parasites into the circulation of the host that causes the disease.
Yikes.
Absolutely yikes. The parasites travel in the blood, first to the liver where they mature, and you wouldn't even notice it because there are no symptoms for around 7 to 18 days. Then the symptoms start to develop.
What are the symptoms?
It says the symptoms include high temperature, fever, sweats, chills, headaches and vomiting. And of course, you know malaria is fatal, right?
What? There are vaccines though.
True. The article recommends taking anti-malarials at the right dosage and finishing the course before you go, plus a consultation with your GP is standard.
I'm starting to have second thoughts.
Now look at question 5.
And their bite injects
There is the answer only in one particular sentence. Check your answer.
The practice manager's just approved my leave. It just got approved, so guess who's going on holiday?
Judging by your smile, I'd say you. Anywhere nice?
Haiti. Although I've no idea what to do about the malaria endemic. Do you know much about malaria?
Actually, I saw an article about it the other day. Where did I put it? Oh, here it is. So it says, malaria is a major disease affecting hundreds of millions of people throughout the world. It's been around for thousands and thousands of years, and it's mainly found in tropical countries. The disease is transmitted by mosquitoes, and it's usually the female mosquito that bites humans. It's part of the mating process for the parasites, and their bite injects parasites into the circulation of the host that causes the disease.
Yikes.
Absolutely yikes. The parasites travel in the blood, first to the liver where they mature, and you wouldn't even notice it because there are no symptoms for around 7 to 18 days. Then the symptoms start to develop.
What are the symptoms?
It says the symptoms include high temperature, fever, sweats, chills, headaches and vomiting. And of course, you know malaria is fatal, right?
What? There are vaccines though.
True. The article recommends taking anti-malarials at the right dosage and finishing the course before you go, plus a consultation with your GP is standard.
I'm starting to have second thoughts.
Yes.
Now look at question 5. You hear a vet discussing a new cure.
Right. So, question number 28. 7, 6, 5, 4, 3, 2, 1, submit. This is pronunciation, short vowel and long vowel. Okay. 18, 18, or 8, 18. Okay. So that is the short vowel and the long vowel. Yeah, now let us see here. (28) is C. So update your score. So 1 by 6, 2 by 6, 3 by 6, 4 by 6. Update your score. Right. 2 more questions, last 2 questions. Yeah. So if anybody is interested, you can contact me. For the doctors, it is 40,000 full course. And for the nurses, it is 25,000 full course. And for 1 month, for doctors, it is 25,000. And for 1 month nurses, it is 15,000. For nurses, I give special discount because they are less paid. So whoever is interested, you can contact me. Right. Next, 29. You hear a veterinary doctor. You hear a vet discussing a new cure. Leptospirosis may pass to humans from dogs via contact with the dogs. Leptospirosis may pass to humans, okay, via contact with the dogs. What? Dogs' saliva, dogs' urine, dogs' feces. Dogs, what? Saliva or urine or feces. So saliva, right? That is from the oral contact, mouth. Okay, the saliva will be falling down from the mouth. So if that gets in contact with the skin of human being, that's number 1. Number 2, urine, okay, a liquid, and feces, solids. So you try to analyze the question like this. Try to analyze the question like this: saliva or urine or feces. So right. So try to be very cautious here. Try to be very cautious. So think about all these things. So anything may be a chance. Anything may be a chance. But most likely, the animals will get in contact with human beings. More chances are there for saliva. Saliva. Because almost always it will be salivating. So that's it. So just reason like this one. So leptospirosis. Leptospirosis. Now, you have to leptospirosis. So that's the key word, right? That's the name of a disease. If you know the subject, it is easy. You need not listen to the audio also. That's very wonderful. But if you don't know the subject, then it's tough. Okay, you have to listen to the audio. So there is a disease. There is a disease. Cure will be in the end. So this answer will come in the beginning only. You hear a vet discussing a new cure. So in the meantime, so before the cure, the disease will come. Disease will be explained before. Then only how the disease comes. First, name of the disease, introduction to the disease, definition of the disease, then causes of the disease or modes of the disease, reasons for getting this disease. Then afterwards, so how to analyze that disease, how to diagnose this disease, then finally, how to cure that disease. So before, it will come in the first half only mostly. So like this, you have to understand how the question is, right? Last two questions, bear with me.
I wanted to discuss leptospirosis, or Weil's disease, in dogs. Canine leptospirosis, or lepto, can be asymptomatic, making it difficult to detect. However, when symptoms do occur, they include fever, vomiting, loss of appetite, and lethargy. It's not a new disease. It is actually quite ancient, but it is being detected more frequently due to advancements in technology and improvements in diagnostic skills. Lepto is zoonotic, which means humans can contract it through coming into contact with the urine of an infected dog. If anyone in your household becomes unwell during this period, e.g. developing flu-like symptoms, they should see a doctor swiftly. There is a vaccine for lepto, but not all vets recommend it. It could be scaremongering. People think that there is an epidemic, but it could be that we're just detecting it more frequently, as previously mentioned. There are 20 serovars of the Leptospira bacteria, which means it's hard to know which strain is actually affecting the dog, and therefore there is a fairly high percentage of the vaccine being ineffective. Some also argue that the vaccine is made from killed bacteria, which won't in itself create a response from the immune system to make antibodies. So a strong adjuvant is added to elicit a response. This can carry a greater risk of adverse side effects, especially in animals that are older. There is a cure, but making sure your animal has a healthy immune system and lifestyle may mean that a vaccine might not be necessary.
Yeah, I told you, cure comes last. You have seen the process. This is called the procedure. What comes first, what comes next, what comes last. This answer will be only one word. And when that answer comes, you have to be ready to catch the answer. You have to be ready to catch the answer. If you miss that, that's lost forever. Because he will not talk about everything else. So actually, this is a very dead easy question. This is a very, very easy question. But only the thing is, he is not testing you. He is testing your attention. He's testing your focus. He's testing your concentration. He is not testing your language here. He's not testing your language here. How far you are attentive when that word comes. There was an advertisement when I was young, you know, all out advertisement. Some animal like that, or suddenly opening the mouth and catching that. Suddenly when the mosquito comes close, suddenly it jumps and opens. Like that one. You should be ready to catch like that one. Like that chameleon, like that lizard, which throws its tongue and grabs the prey on the spot. Just 1 second, the answer comes, the answer goes. Be very careful. These are the different types of questions you will miss if that one particular second that word comes, don't. Okay, so that's it. So I don't think I need to repeat this one. So question 29. Yes. 7, 6, 5, 4, 3, 2, 1, submit. Yeah. After submitting, so update your score. 1 or 2 or 3 or 4 by 5. 36. Or 1 by 5. Whatever. Amrita, you're doing fine. Okay. Let us check the answer. 29 is B. That's awesome. Yeah, next. Question number 30. Question number 30. You hear a pharmacist discussing a new drug. You hear a pharmacist discussing a new drug. A pharmacist discussing a new drug. What does the pharmacist use to treat staph infection? So, what does the pharmacist use to treat staph infection? Staph, S-T-A-P-H, staph infection. Oxylin, sodium, penicillin. Oxylin is already there, only oxylin. Oxylin, sodium. So take sodium and penicillin. So if you hear the word sodium, sodium is the answer. If you don't hear the word sodium, oxylin is the answer. If penicillin you hear, so oxylin, sodium, penicillin, they are a string. So oxylin is in both. So oxylin only, oxylin, sodium. So first one is only. Second one is sodium plus oxylin. Third one is penicillin. So OSP, O for oxylin, S for sodium, P for penicillin. This, see, when I was a child, when I was second grade or third grade, I heard a word, okay, I don't remember that word you said. No. MVEMJSUMP. I'll write the letters here. Why I'm telling you, there's a big reason for this. Whenever I add you something, that means it is very, very important for you. I remember even now, after 45 years, even now I remember that. MVEMJSUMP. Do you know what is this for? When you were 7th grade, you might have gone through these things. Anybody knows this? Can tell me. MVEM. Yeah, can anyone, all of you have done your schooling. All of you have done your schooling. All of you have done your schooling. But have you ever gone through this 9 letters? Can anyone recall anything? Yeah. My very educated mother just showed us 9 planets. So these are the 9 planets: Mercury, Venus, Earth, Mars, Jupiter, Saturn, Uranus, Neptune, Pluto. These are the 9 planets. Aruna, very good. Thank you. So this is a shortcut to identify the main. Okay, this is the shortcut to identify the main thing. So if you have some shortcuts, these are called some techniques. Otherwise, you don't remember what is first, what is second. What is first, what is second, we don't remember. Okay. So now there's a sentence which you can easily remember. So my very educated mother just showed us 9 planets. So M for Mercury, V for Venus, E for Earth. So this is the order. You will not miss the order. Then in the same way, there is another one. This you will definitely identify now. That is VIB GIGYOR, VIBGYOR. Violet, these are the order. This is the order of the colors in the rainbow. There are many things like this. Okay, many things like this. Violet, indigo, blue, green, yellow, orange, red. This is the order. VIBGYOR. So like this. So if you know, you can remember things easily. Now also I'm telling you, why I am telling you is, if you apply some techniques, it will be easy for you to identify what is the most important thing. Oxalin, oxalin. Oxalin without, oxalin sodium, no sodium here. Oxalin with sodium, oxalin without sodium. This is without. This is without. Without sodium, with sodium, and without oxalin. So here, so this is without. First one is without. And this is with sodium. First one is sodium, no. Second one is sodium, yes. And this is not relevant, irrelevant. Okay. So without sodium, with sodium, no sodium at all. Okay. So no question of sodium here. So try to understand this, how you can identify these things. Then you will get a clear picture there. So you are hearing sodium or not? You are hearing oxalin or not? So like this, you have to immediately catch, pounce upon the word. So now your focus is oxalin? No, oxalin is not the thing. You hear penicillin, means penicillin is the answer. You don't hear penicillin at the point of staph. When he may be talking about many infections. He may be talking about many infections, maybe, or he may be talking about many drugs. But these drugs, okay, you have to see many other drugs which they did not mention here in the ABC. You need not bother. Okay, so focus on those areas and try to grab the answer just like that. Okay, last question. Yeah.
So a strong adjuvant is added to elicit a response. This can carry a greater risk of adverse side effects, especially in animals that are older. There is a cure, but making sure your animal has a healthy immune system and lifestyle may mean that a vaccine might not be necessary.
Now look at question 6. You'll hear a pharmacist discussing a new drug. Now read the question.
So I'd like to suggest that we try on oxalin sodium. This is a new variant on a tried and tested drug that was approved by the FDA at the beginning of 2018. It is a narrow-spectrum beta-lactam antibiotic of the penicillin class developed by Beecham. It's used to fight bacteria in your body and in turn can treat many types of infections such as what you're currently experiencing, a staph infection. Or to be slightly more technical, oxalin sodium is the sodium salt form of oxalin. Oxalin binds the penicillin binding proteins in the bacterial cell wall. I don't want to confuse you any further. Take the medication provided and the site should reduce in swelling and redness fairly swiftly and heal up nicely. If you do develop a fever or any other symptoms, please do come back and see us or seek another appointment with your GP.
Yes.
Now look at part C.
Yeah. So question number 30. Oh, wonderful. We have done a good job today. Okay, right. So 7, 6, 5, 4, 3, 2, 1. There you go. Yes, the answer is B. Update your scores out of 6. That's very good. Now, total parts A and B. Update out of 30. Those who have completed all the 30 questions only can answer this. Or how many you answered, that many. Whatever it is. Aruna, 23 out of 30. Amrita, 22 out of 30. Meera, 22 out of 30. Meena, 19. Yeah. Okay, last notice. So if anybody is interested, you can contact me on my WhatsApp. I gave you the number. And so let me see who are the students who are worthy to join my classes on a regular basis. The students who stayed till the end, last minute. Yeah, Annie Mulanga. Yeah, you were there for a long time. If you are interested, you can contact me. Esther, you can join me. Am Mohammed Zahar. Okay. Johara. Yeah, Johara, I have seen you 1 or 2 times also attending. So these students who are new, you can attend the sessions. And today and tomorrow free. And this is May, new batch. Today we started Monday. And whoever is interested, you can contact me for admissions. 5 places for nurses. Maybe some messages I might have already come. I'll go through them and we are closing the admissions tomorrow. So if anybody is interested, get back to me. And before leaving, so what I want to ask you is, I am alive. I'm still powerful. I'm still powerful. I'm still a tiger. I'm not sleepy. Yeah. So what you can do is, let me know. Shall we go with the part C now? Shall we continue? Yes or no? Y or N? Shall we continue? Yes or no? Because actually now the brain will work even faster than the beginning. Yeah. How many want? So majority no. Fine. I agree with you. I respect your decision. So provide your valuable feedback regarding today's session. Please. Yeah. Provide your valuable feedback regarding today's session, please. What did you learn? What did you learn? How was it beneficial for you? Write in your own words. I'll keep for 1 minute. Then afterwards, I'll close the